Good afternoon, good morning, good evening, wherever you are, Facebook family. Welcome to Liberia Shall Rise. This is another edition of the show. We're going to be talking about population health 101. And we have the interesting discussion today. What is the role of the government in healthcare? Right? We just had a new president elected in Liberia. We want to see his plan for for the country. What plan will he have for Liberia healthcare? Is the government even responsible for the healthcare of the country? So these are the questions we have, and this is what we will be trying to discuss this afternoon. So don't go anywhere. Start sharing the show for us. Invite your friends, invite your neighbors and family. Listen, we're talking about healthcare. For you to be strong, you have to eat. So I will admonish you to get your cassava gravy, your tabagi, whatever you can lay your hand on this morning. Get it, because this discussion will be so hard that I don't want you to be even hungry, because we want to make sure that you are healthy so you can participate in this discussion. So what I'm going to do quickly, I'm going to play a song by Camby Adams called Liberia is Rising. Once that song finished, we'll get a show started. So we'll start sharing the show. Do the same for us. And don't forget, like I said, get your cassava gravy, your cassava leaf, tabagi, whatever you can get your hand on, just get it and get ready for the show. All right? We'll be right back. Again, welcome to the show. I don't want to get you to keep listening to that song, a beautiful song that says we will not be strangers in our own land. Liberians will eat the fruit of our land. We will eat the fruit of our land. So the person that sang that song, actually, I have her best friend here on the show today, Miss Camby Adams. I have her own best friend here on the show. So I'm going to bring her for us to get the show started. And then following that, it said behind every strong woman, there's a strong man. So her husband too will be joining. So it's not easy. That whole family business we're talking about here today. Healthcare in Liberia. Why is it important for us to have a good healthcare system? What is the role of the government? Miss Woahloe, welcome to Liberia Shall Rise. How are you, sis?
I'm good. How's my audio?
Oh, you're good. You're good. We can hear you fine.
Awesome. Good afternoon, good evening, good morning, everyone. Thank you, and welcome to Liberia shall rise. Indeed, Liberia shall rise, and Liberia is rising. Thank you, Dr. Pasley, for having me on here this afternoon. I am doing impromptu for the general. I call him my king, the one and only Mr. Pastor Thomas Woahloe, who will be joining us pretty soon. And one of my sister family, Miss Eva Diama, will also be joining us here this afternoon to discuss the importance of healthcare in Liberia. And hopefully we can answer some questions. And if not, we can come back and also have the discussion again. We don't have all of the answers. This is for educational purpose. So please, if you know some of the things that we'll be talking about, just drop your comments and we will be glad to answer to the best of our knowledge. Again, I want to say congratulations to Liberia. Congratulations. We had a peaceful election on November 14th, and we have a new elected president for the Republic of Liberia to Mr. Joseph Yuma Boyka and Mr. Jeremiah Kong and the rest of the team. I want to say congratulations. Thank you to Liberians all around the world for exercising your constitutional right. That is the first step when it comes to health. Thank you for having me.
All right, all right. Okay, right now I want to invite Mr. Woahloe. I see him driving, coming from somewhere. Again, brother, thank you for joining us. Even though you're on the road, you still volunteer to join us. So I want to appreciate you for that. Quickly introduce yourself and tell the audience why is it important for us to have the government participate in healthcare.
Thank you, Dr. Positive. Has my
Your
audio
audience, your audience do. And before
perfect.
you tell something, before you say something, I just want to tell you, your wife got lectures, serial lectures. You can just make her head big like that, make it look so, she want you to speed up, just slow the speed, drive safe, please. Because that lecture hearing you, she missing you, she want you to fly home.
I don't want cruise. I got on cruise right now, so we're good. We're safe. But hey, I had to quickly run a family errand, so I'm coming up from Houston. But hey, everyone listening out there, our listening audience, our viewers on all of the social media, Facebook. Welcome once again to Population 101. Thank you, Dr. Positive. Thank you to the management of Liberia Rise for having us. We come here the third Saturday of every month to discuss population health, to discuss public health. What is public health? Quickly, again, we want to talk about everything, every factor that affects the health of everybody in the country. Okay, in this aspect, we're talking about the health determinants that affect the lives of Liberians. And that's why we're here. Welcome again. Welcome to the third Saturday of the health of Liberians or Population Health 101. Specifically today, we want to talk about the role of the government in healthcare.
Okay. All right. So, Mr. Weller, we loosen you a little bit. We will pause a little bit, then you can come back. But let me bring our other sister on board, Miss Eva. Oh, I see you fixing your camera, so I'll come back to you when you're ready. Let me let you set. All right. So let me let Miss Eva settle in, then I'll bring her back on camera once she's set. But yeah, so Miss Waller, let me start with you though. We're talking about healthcare and the role of the government in healthcare. We just had a mighty big election. So put yourself for a minute, just for a second. I want you to put yourself in the driver's seat now. You just got elected as president of Liberia. What policies or what would be your first step in your first 100 days that you will take to make sure that people say, oh, we got a new general on camp, we got new person now in office, and the action that he's taking right now is going to change the healthcare system in Liberia. What would be that first step you take in your first 100 days for healthcare?
Oh, that is a big one. Well, when it comes to that, I will just love to stay within my comfort zone, but that's a very good question. And we are directing this question specifically to Liberia. as a leader that was just elected as president for the country, knowing the the system that we have in place right now regarding our health. First of all, we want to tell our population what is health. You know, when you talk about health, what are you talking about? When you say you want health care, what is it that you are asking for? So we first of all have to educate our population about the importance of health. What first of all, what is health? What is healthcare? And what is quality healthcare? You know, everybody can have healthcare, but we asking for quality, evidence-based, science that you can actually go to the hospital to be able to receive something that you know when you go home. Yes, there may be 90%. I mean, of 2 to 5% of things that you may not recover from whatever it is that you're going through. But we also want you to be able to receive not just health care, but we want you to be able to receive quality health. So quality healthcare. And so that would be the education that will be going out there. In the first 100 days, we will try to see what policies are in place. Because don't forget, healthcare is what the citizen needs. Is a right for every citizen. It's a right that every citizen must have quality healthcare. If insurance, I will try to implement insurance like medical insurance. Try to talk to private businesses because the government cannot control all of our healthcare business. The government in America, for example, control 10%, 10 to 15% of our healthcare. So Liberia is not an exception. So we will try to invest into private healthcare business. We will try to um, see what policies that we have in place. What can we amend? What can we add? We will see what facilities we have. Are we going to be able to renovate those facilities? Do we need to build new ones? And also human capital. How are our staff? You know, we have to see, do they need like in services, healthcare, reform, like taking them for training or bringing somebody to give them training. So it's a lot that we will have to look at within the 100 days. So I would like my other panelists to come on to maybe add her voice. But when it comes to the healthcare, it's not a one day or one time thing for somebody to put into place. First of all, we need to work on our policy, not just working on it, but we need to also implement the policy. We need to see what we have and what can we add to make it better.
All right, thank you, President-elect. But I'm not too happy with your question. I will bring somebody else to help you.
Well, you're not happy with my answer. That's okay. This is a debate, so let's go ahead.
No. As a President-elect, I'm not too happy with your answer. So let me bring somebody else to help me really understand this. Miss Eva, please. Welcome to the show. Introduce yourself to our audience and then tell us a little more about healthcare. Why is it important for the government to play a key role in healthcare?
Oh, good afternoon. Thank you. It's a privilege to always be on Liberia Shall Rise. Thank you for what you are doing, bringing all the important information out there to our people. I want to commend you for that. And thank you us for inviting me. I'm always here as a backup for you when you need me to. So I appreciate the effort that you are applying to keep our Liberian people in the know, to bring that wealth of knowledge to our Liberian people. So I want to say thank you. Mm-hmm. And thank you for that question that you asked. I think that it's a question that is geared specifically to the Joseph Boakai people that are within the government that he is trying to construct. But if I may say something from the outside in, I would say that the 100 days of the new president being in office is those days that he would take to put stuff in perspective. Because as we know, George Weah presidency has been a total disaster. So I can imagine the amount of work that President-elect Joseph Boakai has on hand. And healthcare is just one piece of those things that he needs to put in place. It would be like a sweep, in my opinion, and putting the right people in places that will be able to take over various jobs and various positions in our country. In my opinion, Liberia needs overhaul. And if I may speak specifically to healthcare, if I was in his position, I'll be hiring experts that have wealth of knowledge that will come on the job running. Because at this point, I don't think we need people that require much of training. I think he will be able to hire professionals that know the job, to put stuff in perspective, to be able to train as they go along. In the first 100 days will not be, to me, in my opinion, to start building new infrastructure. New building as healthcare is concerned. But I would think that the building that are already there, you would make assessment. You want to make sure if they have policy and procedure in place, because those things are the one that govern an institution. So the health ministry have a lot of work to do. They need to put our heads together. They need to see what we have in place as far as policy and procedure is concerned. We want to know how the healthcare system in Liberia is being ran. And when he does that, then we'll go to see if they can literally make a rounding in healthcare facilities and see what we have on hand, how the building look like, what needs to change. We really need policy and procedure in place, because that's what governs us to run our institution smoothly. So that's what he needs to be focusing on. And you spoke specifically to healthcare, so I'm going to stay within that context. We want to know if our health professionals that are working in our hospital institution have the right training or expertise to take care of our citizens. Because this is really important. If they don't have the right training, it could be a disaster, because you're dealing with people. This is not a machine. A little mistake, a human life is at stake. So those are the things that he needs to be focusing on, because he's going to dedicate those people in the right places to do the right job.
Yeah, thank you, man. I don't know why I keep saying this about the Joseph Boakai. I said, President, you got elected. So I'm going to pass that same question on Mr. Woahloe. Mr. Woahloe. So, brother, again, welcome to Liberia Rise. I know this topic, you have your own route, you want to take it, but me, I like to ask a simple question and before I let that to you on the expert level. Hypothetically, let me put it all of we out there. Hypothetically, you got elected today in Liberia. You are now the president-elect. Within your first 100 days, what are some of the things that you, Mr. Woahloe, President Woahloe, will implement for people to know that we have a new healthcare general on camp, that Liberia healthcare is going to be taking a new role in the next 100 days? What will you do? National exam question.
When he make his reference, I would like to come back, because I read.
Hold on. We'll bring you back. Hold on.
Okay.
I will answer the question in the context of the topic today. Me, president-elect, as the president-elect today, okay, I will focus on what the priorities of the government will be to promote the health of the nation. And today's topic being the role of the government in healthcare, I think one of the most important thing I will focus on in the first 100 days is to put in place those type of organizations and structure that will help to propel the success of the healthcare system. Okay, organizations like whether is autonomous organization or they are public health institutions or whether local health organizations that will help to provide the information we need to show us the gaps that we have in our system. We need to have organizations that will promote what we need to do. It's not an individual thing anymore. So as the president-elect, I will focus on the kind of structure that will promote the health of Liberian people. So that will be my focus for the first 100 days, Dr. Positive. And that's what I will focus on as the president-elect today in Liberia. Which means, for example, if I know that the administration of the different health organization in the country needs some push, I will quickly call those expertise that need to put that in place. If the country needs surveillance, data collection, I will quickly call expertise that can promote that area. If we need a Liberia CDC, I will quickly call the experts, public health experts, epidemiologists to come and put in place a Liberia CDC or healthy people, healthy Liberian people like they have here in America, so that we can know where we are as a nation. It's extremely important. If we will affect the process, we need to know where we are as a nation. Where are we? What we know right now is the government contributes less than 1% of the cost of healthcare for every Liberian, which means if it costs $100 to take care of one Liberian every year, the government contributes less than $10 of that amount, which means the other $90 you got to have people somewhere in America to help you, or just like what happens, you can have a simple motorbike accident and then you die from the effect of that, from your injuries, merely just because you did not have the money to do a X-ray or MRI to see that you were having blood clots to even know to seek the treatment. So those are the gaps that I will pursue. What are the gaps that we need to jump on? The solution to a problem, first and foremost, is to know what the problem is. So we need to know exactly what the gaps are in our healthcare system. Then we address it from there by putting in place the kind of organization that will address the issues. So that will be my focus for the first 100 days as president-elect in Liberia today. That capacity, if I may rest there.
All right. Let me come in real quick. Let me come in, Dr. Paye.
Mr. President. Yeah, so Mr. Woahloe, you can go ahead and since Eva can go on. And I'm testing and button, you can go now.
So again, this is for educational purposes. We're not here to diagnose, to treat, or anything. But Woahloe is mostly the administrator. He's the one that goes out and write the policies, write the bills, and everything, and put it in place. And we, the nurses or the healthcare practitioners, we are the one who follow the policies, who make sure that when you say, okay, all employees, for example, this is one of the policies that we're talking about. All employees in the healthcare field should not drink alcohol or smoke tobacco. That is a law. That is a policy. And before and things have changed over time, because before people used to take their break, nurses, doctors, which our healthcare department you find yourself in, used to take their break and go out and smoke or smoke in the break room, and it was okay. But when there was a research that was done that, Mr. Woahloe is the research person. He's the one that said, okay, we have a problem. This is the problem, and this is the policy that we need to put into place so that we can curtail this problem so it cannot get out of hand. So that's his job. Our job is when he brings that policy to us in the healthcare facility is for us to carry that out. So that's what a simple example is. When we used to smoke in the break room, There's a policy that was put into place. No, it's affecting your health. It's affecting your patient care. You can no longer smoke in a break room. You can't even smoke 20 feet away from the facility. So these are policies I'm talking about. Again.
So thank you. Hold it right there. Let Ms. Diama add on, then we can go to the next part, because I don't want us to stay on the presidential thing. Mr. Woahloe got something he want to put in. So let Ms. Diama come in, then you can come back in later on when we go to the next segment. Thank you.
Okay, so
go ahead. President-elect.
President-elect Ivan. For the first 100 days, I just want to add on that assessment would be one of the first priority. Just like Mr. Woahloe said, I want to know if there's gap within the healthcare system. If so, what is it? If I know what the gap is and what the needs are, then I will implement or implore or dedicate people or designate people within those right places to be able to carry that job along.
So someone will says Diva, somebody will say you've been running for office for the last 18 months. That now you come and do assessment, you don't get your people ready to run, you don't get your people ready to roll. And I see all of you talking about assessment. The whole election, we had Kush taking over Liberia. We have this taking over Liberia. As a government that got elected today, will you implement a ZAR to say somebody will get on the ground right now to come up with some plan for us to start solving the drug problem in Liberia? Will you try to? You understand? So look at it.
That's where collaboration comes in, because healthcare is all about collaborating. You know, by now I'm sure that the JFP, my team, already have a healthcare team that we see the gaps, even though we know there is a rampage of drug in the country, but when you're not in the system, you won't know where to start from. Yeah, and we all seen it, we're all talking about it and stuff. Yeah.
I beg to defer. Let's stop it. Mr. Woahloe.
Dr. Cassidy, I don't know what answer that you requiring us to do.
No, I understand. I just wanted to
I want to ask point.
If I your camera
okay, I don't know who.
No, I didn't turn you around, man. I don't get the power to turn you around like that. I only get the power to say.
Dr. Cassidy, can I make one last point?
Yeah, go ahead. Yeah.
What I left out was, given the fact that the first 100 days, you don't even have a budget, you don't even have money, because we know the history of our country. JMB will be starting all over, like from zero scratch. We know that. Yeah. So basically, what they also need to do right now is to tap on the existing expertise in the diaspora and in Liberia. Let me say this: Liberia has enough healthcare experts out there who can revamp the system. Okay, we need to call. It's supposed to be a national call. This is no policy. The health of the population got nothing to do with UP or policy business. You need to call everybody hands on. Okay, you need to tap on the top 100 richest people in Liberia or Liberians in the diaspora to come to the aid and the rescue of the nation. Whether it's in the pharmaceutical, whether it's in the bedside nursing, whether it's in the research area, everybody who can make an impact right now, whether you're living in Europe, Americas, Asia, we need to come to Liberia aid right now, and that call needs to come from the executive marshal.
Amen.
We need to tap on everything we have right now, because you know what? We do not even have a mature population in Liberia. If you talk about the age of elderly Liberians from the age of 65 to 85, 3.2% as compared to America that got 45% of the population in that age group. What does that tell you? We die early.
Yeah.
The life expectancy of a regular male Liberian at 56. So it's about in Liberia, then we got a few years to go by, but thank God that, So it's an emergency that needs a call that should be very resounding, that our people can live longer. that we can have healthcare. People are dying today as we're speaking from simple wounds from motorbike accident. Simple wounds from things like, I'm talking about car accident, a pass mark. You know, before I talk about the 5 diseases that are very, very, very preventable in Liberia, but killing people every day: malaria, typhoid, diarrhea. Those simple illnesses that can be prevented, a killing people in Liberia. So the call gotta be a serious call. We need to live longer to do politics. We need to live longer to work in government. We need to live longer. I'm telling you right now, if one government official fall down, it costs the country almost 50,000 minimum to go treat them in Ghana, Nigeria, or India. When that money can rehabilitate 20 different clinics in Liberia. So the call is a national call that's overdue. So the executive marshal, 100 days in office, we need to take healthcare to be the paramount. You know,
so Mr.
people can
Woahloe,
stop dying.
based on that strong statement you just made, you're speaking like the president now, right? That strong statement you just made, I just want to ask you now the question, the reason we are here, right? People will say, oh, like the past administration wasn't responsible for this, the drugs are in Liberia, the past administration not responsible. So help me understand from the population health perspective, the layman out there in Liberia, why is it important for the government to play a key role in healthcare? Let's bring it to the common people, please. Then I'll let the other panelists come in.
Perfect. The role of the government as the cheerleader. For example, the government put in place a law that says before you become a nurse to work, you must have a license. That's a regulation. One, the government monitors that and make sure every nurse, every 2 years in America, for example, you renew your license. And they hold every employer responsible, which means there's someone sitting somewhere that had a database of all nurses in America and make sure before you renew your license, you got to go and do the CEU, the requirement. 1, 2. They also determine that before you even operate a healthcare institution, you have the requirements before you can qualify as a hospital or clinic. 3, before you even start to say you want to do healthcare, whether it's the provider, you gotta be licensed. Okay? Then on top of that, the regulation is everywhere and they make sure that everyone is in compliance. Okay? What does that do? That means you have competent people. Okay? You don't have anybody who can just put needle in orange, they can give injection. They make sure that everyone who is giving injection out there is competent. Okay? And they go through the employers to make sure the competency is by requirement. So the role of the government is so important that not just ownership. No, we're talking about where they become the policemen of the system, the structure, and the operation of the healthcare system. So it's a responsibility of the government that is supposed to take very, very seriously on a daily basis and then make sure it's implemented. Now, the good thing I must say on the Liberia part is most of the regulation we're talking about is there, except that it's not being implemented. The policing of it is what is missing. So I will stop here and give my other panelists the chance to tackle other aspects of that, the importance of the government role in a successful healthcare system.
All right, let me bring my sister, Miss Eva, on. Sis Eva, the role of the government, you are talking about policy, so I'm bringing it back to you. Say I was not letting you to really flow, so I want you to flow now. Let me know, what is the role of the government when it comes to healthcare, based on your experience, right? Mr. Woahloe just said the government can play a police role, right? Now, and then also a cheerleader role. Help me expand on that. The common people, imagine, let me just give you a bigger picture. Healthcare is not only Monrovia. How can the government make sure that everybody that graduated from nursing school have a job in and around Liberia? How can the government play that role to encourage people to want to work all around the country? President-elect Eva, you got it, flow.
Thank you, Dr. Positive. I look at the role of a government as the person who builds the foundation. And he is the one way up there that builds the foundation for all of his people. And then he instructs that rule to every state or every county. So in Liberia, we don't have state. So the government built that foundation and made that policy and empower every single state or every single county in Liberia. Because every county has a health, I will assume, a health minister or a health person who's
For
at
them
the head of
county health,
every well, county health operation, right? I think that's what
country
they
health
call it.
officer.
Officer. Okay, so that policy is passed on to every health policy, every health officer, and then every county
Okay.
now pass it on to the hospitals, the nursing schools or nursing colleges to make it a mandate. So I think in the last one, Carolyn was saying that the policy is passed in every hospital. The government is the one who built that foundation or make that policy and give it to all the states. So every state operate under the government instruction as to what is expected of them. For example, in Liberia, the executive mansion or the government made that policy, pass it to every 15 states, and then they still operate under that instruction that is being given. Meaning, if you are a practitioner, a nurse, you have to go to either a 2-year college or 4-year college. When you finish, you have to pass your state board to practice. Every 2 years, you need continuing education. You cannot see or touch any patient if you don't have the right credential. That policy is made or constructed by the president or the government in their office, and then pass to every state. So that's what Liberia needs. I don't know if they already have it. It's not being carried on, but now is the time that we have to go back and see what we have. Why is it not working? Because if we clearly have it written down on paper, then the people that are hired to operate within that are hired to do that job need to start doing that job like yesterday. I don't know why my phone making me to go that way. So now in the next 100 days, if that's the question you're asking, then we need to the health minister needs to start running as fast as now to go to every college in the 15 county of Liberia to make sure that they're following that process. Visit all the colleges that teach nursing school or whatever health. It could be pharmacists. It could be how you call them, respiratory therapy, whatever they have in Liberia. We need to start visiting their offices now to see do they have this policy. Do we need to give it? Is it operational?
All right. Thank you, Mrs. President-elect. New President-elect. I hire you as president. I fire you in the next minute. Then I bring another president-elect. Man, you don't get time for the 6 year. You don't get 6-year term. So now, Miss Woahloe, you are president-elect of Liberia. Anyway, Miss Eva, thank you for that great explanation. But I have to fire you. The Liberian people need more. So
you can't be the person firing people like that, though.
But okay, go ahead.
Yeah, so Miss Woahloe, again, I want to put you in a hot seat. You are president-elect. The Liberian people need to see something different. How do you serve as the champion? How do you serve as a cheerleader for healthcare to make sure that every nursing student that graduates from a nursing school first is accredited, right? They have the right credentials, and then also, how do you encourage them to work around the country? Because imagine this, that mother that is pregnant, she's at her final day to give birth, and she have to walk for an hour, 2 or 3 hours, just because the only clinic is 4 hours away, right? And then when she get there, they only have one nurse because all the nurses are working in Monrovia. Nobody want to work in Sepacon. You understand? So how do you, as the president-elect, Mrs. Woahloe, this is serious. How do you, as the president-elect of Liberia, become the cheerleader for healthcare?
Thank you for that question. First of all, you said something earlier, and I would have loved, because this right here is like a debate that the Liberian people needed to hear from their leader.
Yeah, yeah,
So
yeah.
about the healthcare, the security, these are things that we would have loved to hear. Mr. Barker, you want to be president. What is your policy regarding health? And I'm glad we're having this, conversation. First of all, the healthcare, the policy is meaning there to protect and promote quality healthcare for an individual and for the community.
Mm-hmm.
And earlier you made a statement about, oh, why you keep assessing. Healthcare is we do what is it called? APAP, right? Assess, um, diagnose, plan, treat, implement, and then come back and evaluate. And if it doesn't work, you go back to square one. So we're always assessing to see what better way or better things that we can do to promote quality healthcare. So that's why every time you say, oh, we have to go assess, we need people to come and look at the facility. So again, to make sure that care is being provided across the 15 states in Liberia, we can't just have Monrovia controlling everything. That's the problem right there. That's one of the problems. We must have these different states, these different counties stand out. That's why we have leaders in the county. That's why we have senators. That's why we have county health officers. They need to be independent. Decentralization, that's what Liberia needs. As a new president-elect or as a leader in the country, to promote healthcare across the board. We made the national policy and then let it trickle down to the different states. And everybody, what if you're working in Monrovia, working in Lima, working in Grand Gila, working in Maryland, Grand Bassa, everything that people are doing in Monrovia should also apply to those in the different states. It cannot be separate. So Monrovia should not be the one hiring nurses to go work to Grand Bassa County. You've already broken that. So we need a healthcare system, the same system that is built in the center of Monrovia, since that's the capital. It's just like Washington right now. Washington make the laws, put the policy into place, and then all the states adapt it. And sometimes some of the states, they kind of tweak it a little bit so it can apply to their state. So that's what we need to do. It's like me wanting to work with JPS, and I think I've made this analogy before. I can't wait for Austin to hire me before I can work to JPS that is 30 minutes away from me. So every city, every state needs to be empowered. We need to put money into the state so that their people can benefit from it. It can't just be Monrovia, the health minister, only the health minister is controlling every state in Liberia to make sure, okay, 200 goes here, 300 goes here. No, these different states, these different counties need their own money to be able to fund the healthcare system. That's how you will have medical facilities maybe 20 minutes down the street. Because what? The county is rich enough, the county is developing because they are not depending on or waiting for Monrovia to make that decision. And also, again, encourage private healthcare facilities, private people to come with medical facilities, with medical, whatever, to be able to, it's not just the government. It shouldn't just be government hospital that should be promoted. All of these policies, what if you are a government institution or private institution, the policy should apply to everyone. And I like what Eva said, we need to go to the schools. The schools also need to be aware of these different policies. So when you are graduating nurses, these Monrovia needs to accredit it. All of these schools are these schools accredited? Who's giving them accreditation? Who is following up to make sure that these schools or these different healthcare facilities are up to date? They are doing what needs to be done to provide quality healthcare to the Liberian people. So again, the 15 states need to stand out. They need to be independent. They need to be empowered so that their state can, can be able to provide care for their patients.
All right, thank you to you guys. You guys are doing great, and I appreciate your professionalism. Like I said, I'm just the guy with a microphone here, right? You guys are the experts, so I want to thank you for your expertise, and the Liberian people need this. So if I were to ask you another question, right? This is I'm hearing something from you guys, and you mentioned something, Ms. Woahloe. You said it shouldn't be only the government, right? Healthcare shouldn't be only the government. Healthcare should be private and public, and the cost of healthcare is so exorbitant that the government may not be able to pay for it alone, right? So my question to all of you on the panel, maybe we can have Mr. Woahloe come in first, and I will let you guys chime in, is how can the government promote partnership or collaboration with private healthcare companies or private hospitals instead of it being like the Minister of Health have his own hospital, the Assistant Minister of Health have his own hospital. So now there's no competition. It is more of nepotism where I'm promoting my own business instead of promoting the other people that needs to get help. So, Mr. Woahloe, how do you think?
That's not going to be fire.
Yeah. Mr. Woahloe, how do you think the healthcare system in Liberia can work with partnership, collaboration in terms of public and private? And then the next question that will follow that is, who fund the healthcare system in Liberia?
Thank you. I will give you what I know. What I know is the system I work in is in America. Over 60% of the healthcare system in America is owned by private sector. Okay. The pharmaceuticals here, most of the pharmaceuticals here, if you call, Pfizer, Moderna, those are all private owned. They're not government, owned. But it's the government that put the structure in place. So if I want to answer that question, what I would say is the government should be friendly to entertain people that want to invest in healthcare. The experience we've had in the past is someone will say, you know what, I want to set up the Dr. Keller Center of Excellence in Liberia, whereby we want to collect data, a surveillance company. For example, do you even know how the government can get information on you and your CPR? Is because your job requires you to have CPR card. Okay, but it's a government law that says, it's a regulation that says American Heart Association should require all licensed persons to provide your name, your email address, and your physical address and telephone number. That information going to a database that the government has access to. That got CPR card in the country, the government data on you. That information going to a database. You know how that came about? The government was very receptive to allow American Heart Association to set up and operate in their own expertise. One of the things that killing the situation in Liberia is the fact that if you go to Liberia right now, you get 100 MRI machine, dialysis machine, you got everything to jumpstart the system and promote it. You know what will kill your effort? The system is not welcoming. It will discourage you to the point where people go there to invest and they leave. That is the role of the government. The government should be the cheerleader. That's what I mean to be the cheerleader. The cheerleader is you stone the sideline, you cheering for the players. Encourage the players to give the system the best. Encourage the doctors, enable the nurses to give the practice the best. Okay?
Okay,
I'm sorry?
1 second, quickly. I know you were, but finally, I just want to tell you guys watching, if you want to call in, please, the number is on the screen here. You can call in to participate. If you are in Liberia, you can call on WhatsApp and we'll be able to get you. Mr. Woahloe, go ahead. Sorry.
So being a cheerleader means that you don't only make the rules, but you also, make sure that you make it easy for people to enter the industry. Okay, you don't make it so stringent to the point where what you see happening, what we know when I walk into the few little clinics that we work in, the way in which the nurses and the management there interact with the patients is something that trickles up from the top. Okay, when you start to act like you're indispensable, the government act like they're indispensable to the system. No, you should be, like they say, our economy was called a free port of Monrovia. It was a gateway to West Africa. I'm not saying open it for any Tom, Dick, and Harry to just kind of dump stuff there. No. I mean, if somebody genuinely want to make an impact on the system, encourage them. Okay? Promote what they can do because they're coming to help. I know I'm not talking about the corruption right now because everywhere. I'm not talking about corruption right now. I just mean a system that's welcoming. Okay? A system that will enable people who are capable to come and be part of the system. What I do, for example, I'm a private operator. As an executive director for a facility, I'm an administrator. But guess what? Every month, anytime that the government deem it necessary to work in my facility, they come there and do a survey and investigation. Check and balance. So I can't just be there on the other side and say, oh, I can do whatever I want to do by myself and nobody, no, it will not fly like that. So if the system is like that, the government will become open where everybody know that this is what I can do, this is what I cannot do. In the same vein too, the government can be very, very, approachable, which means that anybody who wants, and when I mean anybody, I mean stakeholder, somebody with influence, who is able to contribute meaningfully to the system, can approach the health minister and be able to present. Like they have a system here. If you know that you can do a very impactful project in America, they invite you to present an abstract. Okay, you present that abstract. The abstract says, "This is who I am. This is what I can do, and this is what I want to do." You say your proposal to the minister. If there are 5 people to present that proposal, they take the best one and they work with whoever they deem is necessarily the more competent person. So the collaboration we're talking about is to be the cheerleader, which means to be able to be open-minded, open your heart for people who are able, whether it's from, if anybody come from CDC, they're capable. For the sake of the greater good, the Liberian people health, let's entertain whoever is capable to be able to foster that relationship and promote a healthcare system so that we can live longer in Liberia and have good healthcare system so that we don't have to be going to India where somebody need an MRI, or we have to fly government officials to Nigeria only because, JFK is overflooded and we don't trust the system. So I will let the other panelists to contribute.
Yeah, again, thank you so much for that extensive explanation, Mr. Woahloe. And what I just wanted to add to what you were saying was, imagine this, where you have a system where the government is open enough that they even have a website where you say you want to come and provide a vaccination. You go and apply to say, I want to provide vaccination. This is how I'm going to do it. And then they take you through a process. Once you submit that application, your process starts. Then after that process starts, they take you through some process to evaluate everything you have, and then you get qualified and you start operating. I think if we start looking in that light, eventually Liberia will get better. So we have a caller calling in. I will let Ms. Woahloe to come in. Then I will let me just take the caller quick and see. Hold on. Hello, welcome to Liberia Shall Rise. Your name and where you calling from?
Hi, my name is Gwendolyn. And I'm calling from Detroit.
Okay. Welcome to the show, Miss Gwen.
Can you hear me?
Yeah, we can hear you.
Hello, Sis Gwen. Welcome. How are you?
I just wanted to hi everyone. I just wanted to make little contribution because I'm in healthcare, and I did hear the brother talking about collaboration And I think I'm not sure if he's the one that was talking about when you come to the clinic, the way the doctors and the nurses interact. So, first of all, when I consider collaboration in healthcare, the government in charge of healthcare, I'm thinking about it like what we do in the U.S.
Mm-hmm.
We must subsidize healthcare for it to reach to the people. And we cannot say, oh, but that social welfare system, healthcare can be subsidized because presently, as we speak, when they pass the budget, they put in money to go to private clinics. And that is fine. But those money need to go into the public health sector first. For example, JFK. Money needs to go, the government needs to collaborate with JFK to put money in a system to be able to subsidize people that come to the hospital that can't pay their full bills, to help with medications. We shouldn't be crossing the road to people pharmacy all the time to go get medications. Those should be the priority in collaborating, right? For example, quite recently, a guy died at JFK. He died because he jumped from the building, although the hospital tried to make it like it was a mental health problem. The guy tried to escape and he jumped from the building, and the hospital had to go to West Point to his family to bury him. That could have been totally preventable if the government had been subsidizing the hospital to cover expenses that people can't cover. The hospital, any government hospital, JFK or whatever, shouldn't be like have a special unit that keep people that can't pay their bills. Just keep the people there because they can't pay their bills. They can't pay their bills. That's some of the collaboration. And I'm only bringing it back here because if people walk into the hospital that I work in, we do not refuse them because they cannot pay their bills. You know, we do send them away, say, hey, go get money first. You can't, before we treat you, by that time, the person not beat or to death. People dying in Liberia like that because before they see you, you must put the money down. So if the government can collaborate in that way to give funding to the public healthcare system, that would be good. Also, that collaboration with funds that would provide medicine and stuff. Also collaborate with providing the doctors. Like in America, the doctors I used to work at a teaching hospital. And JFK is a teaching hospital. The government actually pay those doctors, will pay them living wage that would the residents and stuff that cover the hospital that I work in. That budget goes to the hospital to pay those doctors living wage. That's collaboration. Another thing, auditing. We do not audit our institutions. And let me tell you, once people are not audited, I don't even mean auditing in finance or financial audits. I mean auditing like what we do in America, Joint Commission. We have Joint Commission, we have the state audits. They come, and if people are dying on your watch, for example, my girlfriend Ruth Springback, she posted a post this morning about mothers that go to have babies because that's our specialty. Mothers that go to have babies, they die in healthcare. They died having those babies. And those cases are not investigated. Next one, 3 months later, another mom can die. 2 weeks later, another mom come and die. And those things are happening in our big hospitals and even in the Minister of Health clinic or hospital that she runs. Those things are happening. And they are not auditing, they're not checking, and that's when like in America Joint Commission coming. If people die in your surgical room, people die going to have babies, the people want to know why people are dying having babies. This is not about punitive measures. This is about correcting the system. Like, hey, was response the people going to do? Was response time too low or too slow? I mean, what was the case that made this mom to leave for her instance with her husband or her boyfriend or her family to take care of? So that's when other things comes in. And when all these things, when that collaboration with the experts, like the expertise can be put together, then we will obtain best practice. That's the only way we'll obtain best practice in healthcare. It could be a collaborative effort, government sponsoring the things they need to pay for. And even, I hear people saying nurses, when they go to the hospital, I myself have experienced it. Nurses not responding, like when they shoot, they be on their cell phone. Those things are ethical things that the healthcare system will need to correct.
Yeah.
They will need to correct it in due time through teaching the nurses because, for example, I've been in my practice for 20 plus years. I'm advanced practice. But let me tell you, when my patient, I'm near the room and I see my patient put the light on, I go there and I make it the best experience for them. Hey man, what can I do for you? How can I make your day easy? That's how we expect it because that's how we were taught. So maybe it's something that our teaching will have to work on. We have to emphasize ethics in our thing and make people to know people do not want to be sick when they come to the hospital. It's a condition that brings them to you. Now the best you can do is to make the day easier by giving them best of care.
Amen. Miss Gwen.
Thanks. The conversation is good. I'm listening to you guys.
Thank you so much, Miss Gwen. I would let the panelists respond. I think you are like another expert we can bring on sometime because the woman sitting here in the African clothes, the one on top, she's the president for the Liberian Nursing Association. I hope she know you already so you can connect and all right. But thank you so much. Well thought out question. I appreciate it. Miss Woahloe or Miss Eva, you want to respond to Miss Gwen? Again, thank you so much, man. Keep watching and share for us, please.
I'll come in quick. Miss Gwen made a very salient point, and we haven't reached to that part that she, especially when it comes to accountability and malpractice and stuff. I have been one of those that came out here. I believe it was 3 or 4 years ago, and was trying to fight a case against JFK about this 5-year-old boy that died because of negligence and because of neglect and because of malpractice and all of that. So those are things that our healthcare system, we need to work on because those things are there. Yes, we do have to feel good healthcare workers in the healthcare system. But then again, if you have family or friends in the government, that's why we need to get away from the Minister of Health being the only one to hire healthcare practitioners to go and work in these public institutions. We need to stop that. Then why do we have an administrator in the hospital? Why do we have the HR? Why do we have the director of nurses and stuff if they are not qualified enough to hire someone to come and work in the facility? That the nurse has to be hired by the Minister of Health, and they have to come from Monrovia so they can disperse them in the different counties. That's the reason why no one has been held accountable. Maybe few people are being held accountable, but majority of the neglect and the malpractice that takes place in the healthcare system in Liberia, in healthcare facilities, people are not being held accountable because somebody feel like, oh, I'm untouchable. I was hired by this person. For the example, the healthcare minister that we have has her own private clinic. That right there is conflict of interest. That is conflict of interest. And secondly, there have been multiple deaths at her clinic, multiple deaths that no one investigated her about, multiple deaths that the family did not get any justice or any answer to why their family member came to have a baby. They were healthy and nothing happened about it, and she's still holding her position. These are things that we are not even talking about like the piece of paper. With everything about the healthcare needs to just entire reform. And yes, we need, again, I've said it over and over on my platform, we need every state to stand out. Last time, before Eva come in, this clinic we work at needed a janitor. Can you imagine the minutes, because this is a public clinic, that janitor, the administrator at that clinic could not hire the janitor. the DON could not hire a janitor from down the street that is qualified. So there's no system in place to say, oh, there's a job vacancy that people on the website to actually apply and let them go to that hospital, that facility, to the hiring department for them to review your CV or your resume to see who's qualified for these jobs so they can come and have an interview. So guess what? A janitor, because this is a public institution, need to be hired. That's how they have the policy. The policy says the janitor, everyone that's working in the public facility needs to be hired by the Minister of Health Promotion so they can disperse into the other.
I just want to support what you're saying quick before I forget my train of thought. I would kind of put it in your shoes. You guys are the expert. You've been on ground, and somebody said you guys should work in the neighborhood, in like villages, and I know that's something that you guys already do, the Liberia Nursing Association. You already go to Liberia, right? So since this is a new administration, right, can the Liberia Nursing Association, based on your experience in Liberia, what you're saying about nurses not being able to be hired in Grand Jita if there's a hospital, there's a vacancy by that hospital, can you draft a policy suggestion and submit it to the new administration while they are working on their thing for them to get started as part of their 90 days or 100 days at least, so they can have that paper in their hand? Or you can even send an open letter, right? Put it on Facebook. Let's share it as much. We can pay Facebook $10 and they can send it to 1 million people and stuff like that. Let's do an open letter to the current administration and say, as a nurse practice or as a medical practice or as an association, we went to Liberia, and these are some of the problems we saw in the previous administration. We are asking the new administration to please consider this, that hiring of nurses or medical staff should not be done at the health ministry. They should be, maybe they should be, their credentials should be validated at the health ministry. Their credentials should be validated at the health ministry, but hiring should be done by the hospital or the facilities that are hiring them. Like you said, even a janitor, why does the Minister of Health have to approve a janitor? You understand? Anyway, I will stop there. Miss Ambassador Herring, if you want to call in, I will give another 10 minutes for us to wrap the show up. You can still call in. We'd like to hear your point of view. Please call in if you still want to call in. The number is 682-503-9906. Again, number is 682-503-9906. I'm going to put it back on the screen. You can call in, but I'm seeing your comments here, so I would like to share that as well. But that's the number. Please call in.
And to her comment, yes, we as the Liberian Nurses Association in the Dallas-Fort Worth, we've gone to medical mission trip before. We've gone to the remotest place in Liberia, in the village before, and we taught those midwives that can't even understand English. We had someone there that was interpreting for us. We spoke our little, Kodokwa English, and they were able to interpret it into the dialect that they can speak. And those midwives, we left baby resuscitation, the pump to resuscitate babies. When the baby is born and the baby is not breathing once the baby is born, we left those supplies, medical supplies with them, and they were able to use it on some of the babies that were born that couldn't breathe, and those babies were able to breathe and they are living. Those are things that we do. So yes, to answer your question, we do medical mission, and the Liberian Nurses is also doing community outreach, community health, where we have nurses in Liberia that goes out into the community to talk about, the basic health care, how to take care of yourself, the signs and symptoms that people are experiencing. They explain these things to the nurses, and the nurses make recommendations. They check their blood sugar, they check their diabetes and all of that, and nurses are making recommendations to them to go seek further medical care. So yes, and Miss Eva, of course, Mr. Woahloe is part of the team that we have here in Dallas-Fort Worth.
All right, Miss Eva, let me let you chime in a little bit. You've been very quiet, and I don't know you to be a very quiet person. So please say something, please. You can respond to Miss Gwen's statement. Are you muted? We can't hear you.
Oh, I've been listening. They have, I mean, all contributed already great information to the Liberian people, and I'm hoping that I hope the Liberian people are listening. So the question that you asked, I got a couple of pointers that I want to point out.
Okay, go ahead.
And I can't even remember that question again, but this is what I wrote down. Concerning, I think the question was if what can we do to straighten the system?
In partnership,
Okay.
collaboration with the government for the private sector and the public sector to collaborate to make sure that healthcare system work in Liberia, since the government don't have all the money that it would take to run the healthcare system in Liberia. So that was my question. But
Okay, so this is what I'm gonna say. I have a 3-4 answer. So my first thing would be collaborating. The government needs to collaborate with people outside of healthcare, meaning like IT people. The reason why we have stuff, going on smoothly here is because the IT work with the nurse informatics to build a system that work together. So Liberia needs an IT person that will build that system, right? And then the informatics will come and work with them to put in the terminology that those two will work together. And then my second thing would be we need empowerment. The government needs to empower the private sector so that the private sector will see Liberia as a safe place to invest. Nobody wants to come to a place that is not safe. I know that a lot of Liberians have money and they want to invest in Liberia. They want to build state-of-the-art hospitals. They want to build the system to where Liberia will be the number one. But it has to be a collaborative effort. And then my last one will be customer service. Once the IT people come, they work with the nurse informatics to build our system, and the government empower those private sector to be safe to come and bring job in our country by building infrastructure or whatever that they need. Then we need to teach them customer service. Because if there's not an adequate customer service, the patients will not be safe to come into your hospital. And when the IT are building those stuff behind the scene, they should make it to where we do it here in Liberia, where the hospitals are on Google. You can literally research a hospital next to you and find their rating to make sure if this hospital or clinic have a 1-star to 5-star rating. Is it a safe place for me to go and care my family? Is the customer service the best customer service? Meaning, are they going to be able to take care of my family member in the way that they will feel safe? A lot of Liberians, let's say if you interview patients that go to Liberian hospital right now, I would say 85% don't even feel safe in the hospital. They consider our hospital a death trap. We need to change that system. We want our patients to feel safe to come in our hospitals. We want them to take us health practitioner in Liberia, a collaborative partner. You're not up here and the patients are down here. It's because of the patients that you got a job. So if we make our patient understand that, and we make the nurses understand that without the patient, they can't employ you. Then the reason why a lot of black bears are in Liberia is because the people don't feel safe going to the hospital. I'd rather go next door to somebody who have black bear, who's my brother, my sister, to give me the good care that I need, than going to one hospital that the nurses are yelling and shouting at me when I'm in pain or on that phone if I'm in labor, I'm trying to have baby, I don't need no nurse on that phone or telling me what I did to have the baby. That is not the time for it.
So let me thank you. Let me come in real quick. In order to the IT stuff, the thing, everything is good. So we are asking, and that's another thing we need to do within this 100 days to see how can we get a stable, a steady times of our number. Half of our problems in Liberia will be solved if we have 24/7 running water, we have 24/7 electricity. I went to hospitals and clinics in Liberia, and my husband, one time he went to a clinic in Liberia, and these are government-owned clinics. I'm not talking about the private. Right now, we're talking about government, okay? And the private, right now, we are talking about government because the government, the people are the one who put you in power. If you don't give them something to help them to live a good life, who will you be able to lead or rule? This hospital is asking us for bed sheets, for this, for that, for mosquito, this and that. But then guess what? He went in the room, the windows are open. Why is the window open? Oh, because they need a flow of air. There's no, because it's so hot. So now how can we contain the mosquito? First of all, we need to fix the problem. We need to fix that window so the mosquito can stop coming inside. So these are the problems. We need our hospital. Our nation is a generator nation. Why? If we say we are so good with supplying, and I'm going to put this there, we are supplying Africans with electricity, why don't we have electricity? We need the pipes, the water, that zero, it rain. I think why? It's 19 months out of the year, it rain in Liberia. We have water. We have natural rain. And other countries don't have it, and then we don't have running water. We don't have electricity. And you go to hospitals. These hospitals, the windows are open, the doors are open, everything is coming in. How are you going to be able to contain the germs and the infection? So that's another thing we need to look at in our first 100 days.
I'm sorry.
Miss Eva, your phone now flip again.
I don't know why it's doing that automatically, but I wanted to finish my train of thought before I forget. Thank you for that addition, Caroline. I think let me say my closing comment for the information dissemination in starting with the collaboration process for all the information to reach every 15 county. We need the IT people to collaborate with the healthcare system to build that system.
That's job for me.
Yes,
thank you.
where if I'm in Monrovia, if you are in Monrovia and I'm in Nima County, where I'm coming from, and I work there as a healthcare person, if I open my computer, I can receive that same information over there. The informatics, the IT people all need to work together. That's information dissemination for the healthcare people. So we can't just be saying healthcare. There's other people need to work with healthcare. Just for example, the election that just took place. You see, I forgot what that man's name was, the senator-elect. Look at the system. Amaracone. Look at the system that he introduced to Liberia right now. That's something that we can use in our electoral process where he got people in every 15 states, right, or 15 county. They bring information to him through his computer, and he's sitting right in Monrovia and receiving it. So we can do that in healthcare. This is the 20th century where 21st century where the computer is everywhere. We need to start using our IT people like yesterday.
Yeah.
Thank you, Mama. I gave you at least a job opportunity for me in Liberia. Mr. Woahloe, your hand been up for a long time. Please, I don't want your hand to
I know. The ladies are doing really well. The ladies are doing well. Listen, I'm so glad to have both of you on the show. With permission from my manager, we will revisit this topic because I think there's a whole lot that we need to discuss here that people will need to know, that people will need to call here about how much the influence of the government can be in healthcare. Okay, so I can say next month we'll be back again to look at some of the organizations that will help the government, that will help the country to be able to have a very operational system. When we look at the prototype of the American structure, some of the organizations that the government has put in place that are helping the government to be successful in healthcare. You know, as we speak right now, we're talking about trillions. The American government spends trillions on healthcare.
Mm.
Okay, that's the amount of money that the budget invests, and that money is invested and implemented and executed by different organizations. So when we talk about those different organizations, we'll come next month. What type of organization can help the government to be successful? My closing thought, I'm driving, so I don't want my internet to drop and I'll lose it. So let me say this and then I'll be on here. When I was in high school, there were less than maybe 10 or less FM stations in Liberia. FM stations. I'm talking about media influence. We're talking about the government role in the health of the population. And I want to introduce a very weird factor about media presence. In America, there's something called quality measure rating. We get 1-star facility, 2-star facility, 3, 4, 5 stars. And I want to commission everyone that listening, that influencing the media, to start to throw some light on healthcare in Liberia. To the point where we can challenge the healthcare institutions, we can hold them accountable for the quality of care they provide. When I was growing up with less than 10 FM stations, and right now we're talking about over 56 of them in Liberia, we can call on media houses, whether print, electronic, digital, to start throwing some light on the quality of service that our media organizations can provide, so that together we can start challenging. We can start to challenge the clinics, hospitals, healthcare organizations, hold them accountable, so that they don't just put on a death certificate cause of death or no. Let somebody start looking into those reasons. And then I'm not going to throw anything out there, but I'm old enough and I grew up in Liberia where I know normal days, the things that happen, I was opportune to work with MSF. And I know some of the MSF reports from Liberia shows that some of the reasons why they put on no on the death certificate is just to cover the institutions. Because no one holding them accountable.
Yeah.
No one is holding them accountable. Why should cost of death be on no to the point of 40%? Brothers and sisters, I have to see what the issue is. To make it very clear, when 10 women go to give birth in America, those 10 women will come back from the hospital with 10 babies with a mortality rate of 0.0001. If anything happens, any one of those babies, if they don't come back home, we will know the cause of death. If any one of those mothers don't come back home, the cause of death will be known. Very clear. In sub-Saharan Africa, according to MSF, WHO, when 10 women go give birth in sub-Saharan Africa, including Liberia, 4 of those mothers will not come back home. 4 babies, if the mothers come back home, 4 babies will not come back home. That's 40% mortality rate.
Mm.
Which means 8 persons will not come back home.
Mm.
I know that because I work in Sierra Leone and I know the rate in Liberia. Sub-Saharan Africa, no rates are reported. Go and research it. What does that mean? It is so high. We are losing 4 mothers and 4 babies every time 10 mothers go to give birth. We need a media organization to go in there and start asking questions why. And that is how the accountability will come. That is how, when we hold in nurses, the institutions accountable, that is how the government needs to show some light in those places. So that if people know that someone is watching, the government is watching, the media institutions are watching, it will cut down some of those rates, and then our children can live longer and our people can live longer. I wanted to throw that in there. I will give my final comment if we had time, but before my internet dropped again, that's a positive. I wanted to throw that in there. Let me give the chance to the other panelists.
Yeah, before you come in, Ms. Eva, I just wanted to add this here. Again, thank you, brother, for that great point. I think that's excellent. That's what the show is about, the role of government. I just want to remind people about the topic again, the role of government in healthcare. And Ms. Gwen said something that I just wanted to add in support of Eva. She said the government need to partner with IT and people in IT to work with healthcare, right? And Ms. Gwen was adding something to support you and said IT would not work if Wi-Fi and internet is not working in Liberia. Then Carolyn also added to electricity, right? So the problem is big, right? Joseph Barker have a lot on his plate.
Oh,
He
yeah.
played too full. He played too full. So he entering the presidency with his stomach already full. He need to start. Well, he played so full that he got to find a way. And you know, like it's like he played so full that he have to find a way to share the food, or else he will suffer. So what we discuss,
will be swallowed.
yeah,
Or else he will be swallowed.
yeah, what we
He will be
discuss on
overwhelmed.
here, it's so important that he needs to learn how to share. He need to learn how to bring in other experts like you guys. Like I'm asking you, the Liberian Nursing Association, Ms. Gwen, Ms. Hervin, all of you guys that are nurses in America, come up with a short document that you can send to support the government. Let's start from there. Let's start putting our mouth in it. Since we all put our mouth in the election, let's start with putting our ideas in there to help this government. Ms. Eva, go ahead. I will just give you a 5 minute, not 5 minutes, 2 minutes for you to close. And then after that, we'll go to Ms. Woahloe, then Mr. Woahloe.
Okay, thank you so much. So I wanted to say that, yes, it's a collaborative process. And I don't know why my phone keep doing that. They need to work with IT people. They need to work with public works, because the public work people will employ people to do cleanliness, electricity. And I mean, the IT people got plenty of work to do. They're the one going to build that system for us to receive that internet problem, water, road. There's a whole lot. It's a collaborative process, and I'm 100% sure that he already had people set up and ready to run. And my last comment before I close, I hope and pray that the Liberian people are listening to me. The health ministry in Liberia, they need to take away some of their authority. They give them too much power and they are not functioning within that power. The health ministry should only be the people who implement the policy and procedures. They have no place hiring nurses. They have no business hiring janitor. It's not a role to hire medical doctor. I'm 100% against us general surgeon being the health ministry of Liberia. How in the world? Who made that rules? Why is it still there since 1847? We need to go back and revisit that. Healthcare is a big umbrella that a lot of stuff fall under. You got the nurses, you got a nurse practitioner, you got a PA, you got pharmacy, you got laboratory people. There's so much under that umbrella. You can't have a general surgeon under everybody. Let the general surgeon go take care of the medical doctors or the surgeon. Let it have a surgeon association. We need to revamp that, and I'm whole like people are listening. You guys need to take that ball into your own hand, just like you did the election. There's so much happening in Liberia that you guys are not standing up for your own health. You have no business going to, no nurse or health practitioner have business yelling and shouting at you when you go to the hospital, be on their phone and not giving you attention. You're not on that media and putting that butt out there. I hope that they will change that system where the health minister, the one who will tell hospital what kind of pills to get, tell hospital who nurses to hire. That's 1847 practice that need to be out like yesterday.
All right.
Yeah.
Thank you so much, Miss Woahloe. Go ahead. I know the children calling you now. Your time for mother is coming in.
Thank you again, Dr. Positive, for your platform. Thank you, Thomas, for inviting me. It's always a pleasure to come here.
You're welcome. And I hope you don't be a stranger for the rest of the year. We got almost 43 more days in a year. So I hope 10 years ago, you told me you wanted to partner with me on the show. I hope you can come now.
Please, let's talk. Yeah, call me behind the scene.
Okay. No, I put you on Facebook second. No. But Miss Woahloe, go ahead.
No, again, thank you. We've been here for over an hour. This was a good topic. I know the last time we were here, we touched on another topic and it was so hot and we plan to come back. So every time we need to start writing this down. Every time we come back, it's always interesting and we get to learn from each other. Thank you to Sis Gwen for calling. Thank you to the sister that's on here, Ambassador Herring. She's asking if we can commit to come to Liberia to go to the remote village to work. Yes, get in touch with me, get in touch with Dr. Positive, and we can go from there. Again, technology is so good. I think technology is advancing in the healthcare. The healthcare is changing every day. Again, just the way how we used to insert a Foley catheter or insert the IJ or whatever. It's not like that anymore. You know, before we used to put the cook in the peg tube so the clotting can, get away and stuff. We don't do that anymore. Policies are changing and things are getting more advanced and technology is taking over. So I know Eva and I, we were talking the last time to see how we can do telehealth from here to Liberia with the nurses. Like you have patients in the hospital and where we can have access when, Eva is a family nurse practitioner. And where we can talk to the nursing staff to say, I have this patient, this is what's going on, what do you think? And just gonna help out. So that's something that in the works that I hope our healthcare system will try to initiate or will be open to, because you can have practitioners here that can help people in Liberia and hopefully we'll have electricity and the technology available for that. Another thing too that I want to also ask or research, is it okay for a practitioner to come from here and just work in Liberia without being accredited or without taking any tests? Because when I go to Liberia, I'm like, I can only help you to just, check this shit in and stuff. I can sweep the floor if you want me to, but I don't want to actually give care because I don't know what the policy is. So it's something that I have been asking for. Again, we need internet, we need a website that can give us all of this information, what is required. If I'm a nurse practitioner, I want to go to Liberia to work. What do I need to do? So is there a jurisdiction, the test that I need to take so I can get a license for a certain amount of time? and stuff like that. So these are things that we need to ask questions. Again, I went on the website, I asked people, and I still haven't gotten that answer. Okay,
And
so
mhm. And I would just challenge you on that too, though. You can start talking to the US for you to come up with an international nursing practice. How does the Doctors Without Borders practice and stuff in Liberia and all those stuff? So maybe it's something you can start looking into. Finish your thought, then I'll bring Mr. Woahloe in. I see Miss Eva raising her hand. She won't end the show today. So, but you finish your thought. Finish your thought quickly. You got 2 more seconds.
oh no, okay. So again, so those are things we need to look into. Again, the role of the government is to create the environment, is to write policies that will trickle down to the 15 states that people, well, what is going on in Monrovia, what is good in Monrovia can also be good in Grand Bassa County. Or we can have health facilities in the different districts. They have districts like Monrovia has 17 districts. The other counties have different districts. So there can be like a policy that within a district, there's a certain distance. Like right here by my house, I can just walk right across the street and go to the ER. Because what? The community gathered together and said, we needed this, and the city voted on it. And there's a hospital right down the street. It's a walk, and it's literally like 2-3 minutes walking distance from me. So these are things that our senators and representatives need to go out there to talk to the health minister who is at the table making healthcare decisions, writing policies for healthcare workers in Liberia. That's what I want to know. Is it the minister job to make sure she's at the table speaking for the healthcare system? What policies in the last 6 years? What are the new healthcare policies that were implemented or that were passed? What are the policies like that were passed yesterday or last year? Those are things that I look for. I don't see, So we just like right now we are just as Liberians, and I don't want to look down on us, but it's about time we stop working on the surface and go deeper. We need to go deeper. We need to be we are very experienced, we are very educated, but the environment needs to be receptive of those people or those of us that have the education, that have the skills, that have the experience to come in. Teach me what you know. Let me teach you what I know, because healthcare is all about collaboration. We have to collaborate. The physical therapist needs to come. The occupational therapist need to come. The nurse needs to come. The CNA needs to come. The doctors need. It's all of this. It's an industry that people should work together so that at the end of the day, this person that was in coma, when speech is coming, when OT is coming, PT is coming, respiratory,
Thank you.
and then that person will be able to be revived and walk to that hospital.
Ms. Woahloe, thank you so much. You have expertise in so much that it just can flow and flow without even letting 1 minute pass. So, Mr. Woahloe, Mr. Woahloe, you back. I will just let you.
The person I want to go home, so
yeah, I ain't
get out of this show.
we're talking about healthcare. Yeah, I gotta eat, track, and live. So, Mr. Woahloe.
Yes, sir. Dr. Parker,
yes, sir.
we are so excited.
Don't be that with me. 1 minute. You got 1 minute. Go ahead. We are closing talk.
1 minute. Okay. 59 seconds. I got so much to say on my closing statement, but I'd like to close like this. The little that I'm aware of, working with healthcare professionals, and I will go off of what I know, for example, in the DFW area. The amount of healthcare professionals I know, bring it down to nurses. The membership of the Liberian Nursing Association is less than 20% of the total number of nurses that we know in the DFW area. My only plea to all of us as we're calling on the government to get involved in healthcare, to take a place, to make healthcare better, is for us too to step up to the place to be represented. The government needs our help. The government needs our expertise. You guys are out there, you're making all of the influence in your job places. Please step out and make those same changes in the healthcare system in Liberia. Whether you're in the diaspora or you're in Liberia, that's my call to all of us. It's time for us to step up. Our contribution to the healthcare system in Liberia is too minimal. It's way, 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 way below expectation. So I'm just calling on all of us out there, healthcare professional, whether you're a janitor, whether you're a CNA, you're a nurse, you're a physician, pharmacist, doctor, whatever epidemiologist, it's time for all of us to step up and help our country. We got to make our expertise available to the government for the government to use it. It's just a very, very gentle, friendly plea to all of us today. People are dying in Liberia because we sitting back and doing nothing about it. We think going to work and making the money to support our family is good enough. It's not good enough. It's time for us to step up. There's a reason why God gave us the reason to get our degrees, the certificates, the licenses. It's for us to help our country. So my closing remarks is all of you out there, healthcare professionals, it's time for us to step up and be part of this thing. And not just making the money and enriching ourselves and taking care of our own families and forgetting the millions that are dying like you are every day. We'll revisit the topic again, but thank you for listening. Thank you, Dr. Positive. Thank you for the panelists for coming on today. Liberia need our help. It's time for us to wake up and dust our feet and get on board to do what it takes to change the trajectory of our healthcare system in Liberia. Thank you, Dr. Positive. I'll leave it here.
Thank you, sir. Miss Eva, 1 minute. We are 1 minute. We are like American 1 minute.
Okay. So Caroline made a really great point. But all of this thing that we're talking, it will not and cannot take effect if there's not representation. In representation in the government, to be able to make that change. Credential wise, there should be an institution that will be responsible for looking at people's credential and making sure that if you're a nurse practitioner here, they give us the requirement that we can take to practice in Liberia safely. So if it's not on the internet, then it's about time that they put that criteria on the internet that will be able to look at it and be prepared to go back home to practice within our scope. Next time, Dr. Positive, please, I'm saying, please invite us back on your show to where we'll be able to bring our few of our nurses from Liberia to answer those vast questions that we post out today. We know there's policies over there, but because we don't see it on the internet, we assume it's not there. So the nurses that are working in real time will probably tell us what they are working with in Liberia. That's my plea. Thank you so much.
You're welcome. You're welcome. Miss Woahloe, you're 1 minute. And I think
American 1 minute she did there. It was
on your ask, I think it behooves all of us on here to make that happen, right? We have the population health 101 every month, once every month. So between now and the 3rd Saturday of next month, you can put that, you can get those expertise from Liberia, and we can bring them on here to have that discussion. I think it will be a beautiful discussion. So we can ask them questions, and they can ask us questions, and we can actually ask somebody to start doing that research for us. Then next month, we can have a follow-up discussion. Again, I think that's a brilliant idea. Miss Woahloe, you're 1 minute. Yeah, American 1 minute.
Thank you. Once again, thank you for having us on the show today. And we hope that we said something here that will impact the lives of our people in Liberia. It's all for the love of country, for the love of Liberia. We are all one. I just want to send this message of unity and peace out there. Again, congratulations to our president-elect. He's the president for all Liberians, not just for a certain tribe or a certain county. He is the president for every one of us. With that being said, a healthy nation is a nation that develops, that grows, and that does exceedingly abundantly above all that we can ever ask. So I pray that this government will put the health of the nation first and do everything that they can do to fund the healthcare system and to train their people and not just, yes, we say, oh, let's people come from other countries and stuff and train, but we have Liberians that want to go to school. We have people that want to learn. So I pray that we will invest in our people. And if you want people to come, have them come to the country and build the system, build the structure, build the facilities. Let them come and train your people so that when they leave, people won't go back to square one. They would leave knowing that you have empowered your citizens to stand on their own. So once again, I say thank you for having us here. And we need someone at the table to speak for the nurses, for the healthcare practitioners in Liberia so that they can have a voice, give them a voice. Let not the healthcare, let not nursing be the last resort for someone because they can't find a job in the government. But let it be a career, let it be a job, let it be something that they can be proud of, and let the resources be available to them so they can provide quality healthcare to the citizens of Liberia. Thank you for having me.
All right. On that note, I want to thank all my panelists. I want to thank you guys so much for your expertise. You know, without you, the show wouldn't have happened. I want to thank you so much. You know, even though I tried the whole time, I couldn't eat the time off. I couldn't get the time from you. So we went an hour and almost 2 hours, and I think it's great for the discussion, for the problem that Liberia have. To solve those problems, we require more time and more discussion. So I would like to wrap up the show, and I just want to say thank you to all of you guys. You guys have a great weekend. Enjoy yourself wherever you are. All our audience out there, we say have a blessed week. But I will just close with this one message after my audience and my panelists say thank you to you, Mr. Woahloe. Drive safe. We will see you soon. Miss Eva, thank you so much. Take care, everyone. All right, so finally, on that note, this is Dr. Positive. I would like to close the show. This has been another edition of Liberia Shall Rise. The topic is the role of government in healthcare. What you've heard here today, we're not beating up the government, we're not excusing anyone, but the Liberian people voted. And again, I want to congratulate JMB and his team for such a beautiful campaign. It was difficult, but you guys came to the top. Now Liberia is in your hand. You have a clean sheet to start on. There were errors that were made in the previous administration, thus making you to become the leader, the choice for the Liberian people today. You need to reach out to your folks in the diaspora. You need to reach out to every Liberian, bring them on the table. This is not about Liberian in diaspora versus Liberian at home. This is not about Liberian at home versus Liberian in the diaspora. Everybody needs to come on the table so that we can build a better and prosperous Liberia. This Liberia that we seek is not something that we can just magically build. We have to bring expertise on the table. And if it so happens that you have Liberian experts that are abroad that are willing to come on the table on your team to support you, open your arms to them and bring them on the table so that together we all can build a better Liberia. This is our dream. This is our hope, and we will keep this going. This has been another edition of Population Health 101, where we discuss healthcare in its entirety. This is a show that is hosted by Mr. Woahloe, and he's on the road, so I had to take the driver's seat. But again, I want to thank all of you that participated. Thank you so much for your contribution. Thank you so much for your expertise. And thank you so much for sharing the show for us. We appreciate you. You guys have a blessed week. Tomorrow we'll be here with another edition of Liberia Shall Rise at about 2 p.m. Central tomorrow. So if you are in the area, you can join us. It'll be another great discussion. Thank you. Have a blessed week.